All right. Well, good afternoon and welcome to our funding opportunity information session. This is for the 2022-2023 funding opportunities under the 1815 chronic disease program. My name is Regina Knox. I work with Marshall University. Both Sheila and I, Shelia Plogger, work in the chronic disease division, which is located in the Department of Family
and Community Health.
Yes, it's a long name. At the School of Medicine. So we thank you all for joining us here today. Sheila, did you want to introduce yourself?
Yes, my name is Shelia Plogger, and I am the project coordinator. I work with diabetes coalitions across the Appalachian region, and now I work on this project, the 1815 funding project with the West Virginia Bureau for Public Health. But I've worked with Marshall University now for about almost 20 years, and so that's what I do.
Thank you. And since we have a small group today, we want to know a little bit about you. So you don't have to show your camera, but we would like to hear from you, your organization that you work with, and which particular funding opportunity that you're interested in. If you're interested in the SMBP, the Self-Measured Blood Pressure Program, or the Diabetes Self-Management Education Program. So in no particular order, just any volunteers. Or I can call people. Let me see. Valerie, I see you unmuted.
Sure. My name is Valerie Starcher. I work with WVU Medicine, Potomac Valley Hospital in Kaiser, small little rural area in West Virginia. And I'm interested in the diabetes self-management education expansion through referrals grant.
Perfect. Thank you. What about Annie?
Hello, I'm Annie Kennedy. I work with Grafton Taylor County Health Department. I'm not 100% sure which grant we're really focused on, but I'm interested in learning in this session today. I'm also the county outreach coordinator for our organization.
Thank you, Annie, and welcome. How about Morgan? Morgan, do you have audio? We're gonna come back to Morgan. How about Ellen? I see you unmuted.
Can you hear me?
Yes.
Hi, I just joined in. I was having trouble because my original email was for the 14th and not for today. So I'm just getting into the meeting. How is everybody today?
We're doing well. We're just doing introductions just to find out a little bit about the organizations that you work with and which funding opportunity that you may be interested in.
Well, I honestly don't know. My supervisor sent me to this in her behalf because she's at another conference, but I work for Potomac Valley Hospital under WVU Medicine as a community health worker, and we are currently using the self-monitored blood pressures. We are doing that. We've had pretty good success with it, and I would say if we were looking at anything, it would probably be one of those two areas there. Although the diabetes self-management, we do a group lifestyle balance program, and I'm not sure that usually goes through our diabetic educator, so that might be something she would be interested in seeing.
Perfect. I believe Valerie is also from Potomac Valley.
Yep, that's our diabetic educator.
Okay.
Well, welcome and thank you. How about Michelle B. Hancock? I'm not sure if that whole thing is your name. It might be just be Michelle B.
Hi, I'm sorry. I'm the RN at the Hancock County Health Department. I was just on a phone call, so I missed what you were asking.
We're just doing a short introduction. The organization that you work with, which you already said, the Hancock County Health Department, and which program you're interested in.
We do, well, we're on here for the call about the diabetes. Is that what you're talking about?
Yeah, so it'll be the diabetes self-management education.
Yes,
Perfect. Thank you.
you're welcome.
And then Nelda Grimes.
Hi, can you hear me?
Yes.
I'm Nelda Grimes. I'm also from Grafton Taylor County Health Department, along with Annie. I'm the nurse director here, and we're just exploring, figuring out what these grants are, and we haven't decided which one yet.
That's perfectly fine. We're happy to have you. Welcome. I'm gonna circle back around to Morgan to see if you're able to share some information. Do you know Morgan, Sheila?
I do not, but she did say that her mic was not working.
Oh, got it. Oh, I see it now. See, I need to read the chat.
Yeah.
Perfect. Thank you. Well,
This is Michelle again with Hancock County. Morgan is here at Hancock County Health Department with me.
got you.
Oh, okay.
Okay,
Thank you. Thank you so
Thank you.
much for that, Michelle. And this is really meant to be an informal information session. So if at any time you have any questions, please feel free to interrupt us to say I have a question. You can use the hand raise feature or any of those emojis. We like animation and expression over here. We're just colorful people. And we like engagement. So please don't be afraid to talk to us because we're all here to help the communities that we serve. That's what we're here to do. Okay, so this first slide just outlines the 3 different funding opportunities. We're going to go a little bit more in depth about the deliverables, the timeline, and some of the particular requirements that are related to each funding opportunity later on in the session. So we thank you for being here today.
And I'll speak briefly just about our department, the Division of Family and Community Health. We have 3 different divisions. We have a school-based technical assistance center, the chronic disease team, which Regina and I are part of. And then we also have a community health worker team. I had mentioned earlier that I worked for Marshall for about 20 years. Just to give you a little brief history, some folks may have heard of us, I don't know, but the Appalachian Diabetes Control and Translation Project, it's a joint effort between the Division of Diabetes Translation and the Appalachian Regional Commission. We have a 20-year history of building the capacity of diabetes coalitions, which we, in turn, most of them are called health coalitions because they address not only diabetes, but other chronic diseases, heart disease, and that type of thing, to reduce the prevalence of all of those in the 8 states that we currently have under our belt. And we work with about 64 of these diabetes health coalitions. And we've been able to maintain that relationship overall all these 20 years, and some of them have been with us literally for the long haul.
Sheila. So that's a little bit of background about who we are and the history with the type of work that we're doing. A lot of our work in the last couple of years, really since COVID, has shifted more towards West Virginia based. So we have partnered with the Bureau of Public Health on the 1815 grant, which is the CDC funded grant, to implement programs, strategies, referral systems to increase the number of community-based programs and programs that healthcare systems offer to address diabetes and cardiovascular health. So that's what the focus is for this particular funding. It's diabetes self-management programs and self-measured blood pressure programs. This is the 4th iteration of funding, I think. For us, it's either the 3rd or 4th.
It's the 4th, I'm pretty sure.
In previous years, we provided funding to over 21 organizations, a combination of community-based and healthcare systems. And in the blue, Those are all of the organizations who focused on diabetes prevention or diabetes self-management programs. And the red would be cardiovascular health. So that would be your self-measured blood pressure programs, or some have even elected to address both if they have both programs. So in the green, it would be organizations who are working to address both or implementing both of those programs. We do have a minority health program. Those are implemented in 3 specific counties: Cabell, Kanawha, and Greenbrier. We have 4 organizations that we funded to work in those particular counties. So with this iteration of the funding, the 4th round of funding, all of the funding announcements really focus on increasing referrals. So in the previous years, we focused on infrastructure development, strengthening programs, increasing the number of participants. With this 4th iteration, we're focusing on how can we get more people to go to existing programs? Not necessarily creating new programs, but strengthening the capacity of existing programs. So the first one focuses on increasing access to self-measured blood pressure programs through referrals. And you can be either a healthcare system or a community-based organization. The funding amount for that opportunity is $4,000. The next one is also SMBP. The funding opportunity, the funding level for this one is $5,000 because it focuses on improving internal referral systems. So if your EHR doesn't currently have a mechanism for tracking BPs of a list of patients and you want a way to do that, it may be an additional cost to add that feature to your EHR. Or if you want to form a partnership, which we encourage to strengthen the community clinical linkages with another organization so they can refer their community members or participants to your program, you could use funding to do that. So it's internal, improving the internal referral system. And then the third opportunity focuses on diabetes self-management education and support. So this particular program can only be implemented by healthcare providers, outpatient healthcare providers, and the funding opportunity for that is $4,000. Any questions? I'll pause right there and we'll take questions.
So I do have a question. Like I say, we currently have the self-monitored blood pressure program, so I'm not quite sure about your explanation on improving the internal referral system. We have an electronic health record system. I'm kind of curious as when you were mentioning partnering with another organization. I'm just trying to get familiar. Tricia might be familiar, but I'm trying to get my head wrapped around it.
Excellent question. And what we're looking for when you go to the application is we want you to tell us how you envision using this funding. So, because the whole goal is to increase the number of participants in your program. So how would you do that through referrals? If you have an existing EHR, how would you use that EHR to identify new participants by adding a screening tool, a screening mechanism? Is there something you can add to it? Would it be the cost of having an admin person run periodically periodic reports to identify participants for your program? So that's something we're looking for you to tell us how you use the funding in your application.
Thank you. I was just trying to figure out, I mean, we get referrals currently, but they're pretty vague referrals. And I mean, we're doing well with the program, but increasing that and through the EHR, I can see that's the possibility, but that might be something we have to look into a little more.
Absolutely, and that's totally up to you. You would just think about it a little bit, brainstorm, figure out what's the best way to do it. Do you want to use your EHR, those existing internal systems, or do you want to establish new partnerships with other healthcare providers, other community-based organizations, other faith-based organizations, if they have community blood pressure monitoring stations or if they have community health workers out in the community, just a better way for them to refer community members to your program and how to track that over time. So that would require some thinking through. But that was a great question. Okay, so does anyone have any other questions before we move on to the eligibility part? I'll go back to that. So for the eligibility part for the SMBP programs, both healthcare systems and community-based organizations can apply for those funding categories. And then for the DSMES, that would be really only suitable for healthcare providers. I will say that in this fourth iteration of this funding, we are looking for organizations that we haven't provided funding to before. So we're looking for new organizations that have existing programs that have not received this type of funding from us to submit applications. I think everybody on here would fall into that category. Okay, so the application process. In our minds, we think it's easy, but it may not be. So that's why we host these information sessions. We really want to hear feedback from you. It's not intended to be a long and complicated process, but we do have a cover page that it will be transferred to an online platform. So we have a PDF that you can work on to get your application the way you want it, and then you can just copy and paste the information into the online application. So they both have a cover page, and it asks for general information, your name, contact person, tell us about your organization. Does your organization have a fiscal agent? The fiscal agent just really, does your organization operate as a standalone? Some of our community-based organizations don't have a 501c3 recognition. So sometimes they share or they partner with a larger entity to use their 501c3 or their EIN number for accounting purposes, which is allowable. So we ask those types of questions on the cover sheet. The application can be no more than 5 pages. And that's where you explain really what type of, we ask for your target population. How do you envision using the funding to increase referrals? And we ask for sustainability. What are your plans for sustainability after the funding period has ended? And then we ask for a budget. And the budget is just 1-page form, and it has specific categories where you can categorize your expenses, your anticipated expenses. Now, I think I have an example of what that looks like further on in the presentation. So this is an example of the cover sheet. Very basic, your organization, contact person, contact information. How will the SMBP program or DSMES program be implemented? You know, a lot of people have transitioned back to in-person, but you may still be doing virtual, or you may be doing hybrid. We would like to know how you're currently offering the program to community members. This question right here asks, are you currently working with WV Health Connection? If you don't know who WV Health Connection is, it's an online portal where organizations can partner with WV Health Connection to list all of their programs that they offer. So if you have a Zumba class, if you have an SMBP program, you can list your program on the website. People can search for your program by area, and they can actually self-referral or contact you using the information on their website. So we're actually promoting them as a referral option. They do connect to some EHRs where providers can send referrals through their system to you, like from the community. So we just want to know if you're already working with them, or if you're not, that's totally not an eliminating factor. We just want to know. We want to know how many participants do you anticipate enrolling in your program? And then that question about, do you have a fiscal agent? I'm going to stop there and see if we have any questions. Then I'm going to check the Okay. Okay, in the specific applications, there's about 5 questions for each application, and they're very similar. Who's your target population? When we ask who your target population is, are you targeting low-income individuals? Are you targeting individuals in a specific county? Are you targeting individuals who've already, been diagnosed with diabetes, or are you targeting people who are at risk for developing diabetes? Are you targeting people who have a certain BP range? So who's your target population? And then who do you want to work with? Do you want to create more diversity? Do you want to target minorities? Do you want to target the LGBTQ community? Are there other populations that you haven't been able to reach that you would like to do that through increasing your referral networks or systems? The next question is describe your current referral system. Are you using your EHR? What is the name of the EHR? Do you want to work with other organizations to expand referrals, and how you envision that working? Describe your plans to address health equity barriers. That's been, since COVID, we've seen a lot of health equity barriers. And when we say health equity barriers, it goes back to those social determinants of health, people who don't have transportation, people who are in lower socioeconomic statuses, people who have lower education. So if you think about those people who may not necessarily know about your program, but they would be at high risk for some of these chronic diseases, and how you can better reach them. Explain how you plan to work with community-based organizations or other healthcare providers, because we always want to expand our network. We don't want to work in silos. We always want to work with other people to expand the community clinical linkages. And then describe your plans for sustainability. And I'm going to pause right there and see if we have any questions. Okay, y'all mighty quiet out there, mighty quiet. I'm just assuming everybody understands. If not, then you can always email us or contact us after today's session. And then the budget. So we know it's not a lot of money. However, during our experience working with diabetes coalitions or health coalitions, we know that organizations can do a lot with a little bit of money, especially if it's developing a system that they can continue with little effort, like making changes to an EHR or developing partnerships. Because once you have that partnership, you can continue it. It just takes a little bit of effort and hopefully a little bit of money to help you get started. So that's what our thought process is. If you're not thinking like that, please let us know so you can take the feedback back to our supervisors to possibly make some changes. So with the budget, we have a budget form. We have categories for personnel, program materials and supplies, technology, office supplies, marketing, especially if you're going to partner with a community-based organization or another healthcare system. Based on our experience, marketing can help your program blossom or cannot have the impact that you want it. So marketing can be a big piece to that puzzle. And then we have an other category. So if you're not sure where something goes, you put it in the other category. So things that can be used in the budget. So these are things you can include: infrastructure development expenses, class materials, curriculum, education, food model, referral software. And then we did place a cap on administrative costs, which you can put in the other category. It can be no more than 10%. So for a $5,000 grant, the administrative cost would be $500. The personnel cost. The personnel cost can be no more than $500. Now, personnel costs to go in the personnel category because it's capped at 10%. I apologize about that. Any questions so far about the budget?
I have one.
Okay.
I think I'm the only one that keeps asking questions. what about the actual cost of the blood pressure cuffs?
That would go into program materials and supplies.
So it could cover those though. That's not,
Yes.
okay. All right. I just wanted to make sure.
Yeah, especially for SMBP program, you have to have participants need a way to monitor their blood pressure. So that would go up under program materials and supplies. And what were you thinking about, a loaner cuff program or something else?
We're not doing a loaner plan at this point. And we are providing cuffs for every individual that we've come across. And I don't like the idea of loaner because of the cleaning issue. And I have a feeling it's going to be worse than a library book, getting them returned. But I know that was a question for, I believe, another grant that we had used. Was it a loaner or were they being purchased? So I just want to clarify for this particular one that they could be purchased and given out instead of just loaned out.
Okay, so I have a disclaimer. This funding, they encourage loaner programs. However, there is no restrictions about them getting returned. So we always tell programs that if you have a loaner program, if they don't come back, then there's no guidance on that. So does that make sense? Can I say that without providing additional explanation?
You did exactly what you were supposed to do there. And I have heard that before, but I wasn't, like I say, I'm just kind of sitting in for Tricia, and I just want to clarify that it's the same thing. So I appreciate, yes, I appreciate the clarification.
You're welcome, and thank you. Okay, so deliverables. So what do you want you to do in exchange for this small amount of funding, which we do recognize? We want you to designate at least one person to serve as a contact with us. That person would participate in quarterly meetings and submit quarterly reports. And we've transitioned over the different iterations. It used to be monthly. That was a lot for organizations, especially if you're trying to implement a program, you have multiple duties. So quarterly seem to be fitting well with, Sheila, you have a question?
No,
Okay.
no, I was getting ready to yawn. Sorry.
So quarterly seem to fit better with the schedules of the organizations that we have been working with. We would ask you to have a minimum of 2 staff complete at least 1 hour of distance learning training on the WVU learning system. It's called Talent LMS, and we do have monthly information sessions, all focused on chronic disease, community outreach, and they're only 30 minutes. So we just ask you to watch or participate in 2 of those. Develop a referral system. All this is focused on referral. It kind of ties back in to the mission and the purpose of the grant. And that's pretty much it. The reporting, because the implementation window is short, it would be December 1st through June 29th, 2023. And since we have quarterly reports, you would only have 2 reports. So the first report would be due in April, and that would be from December 1st through March 31st. And the second report would be due in July, and that would be from April 1st through June 30th. Any questions about that? Okay, timeline. The application is due on November the 4th. This is our second information session. It's going to be a short turnaround just because of the tight time window. So applications come in on the 4th. We're going to send out notifications by the 9th. We're actually sending all your documents back to us by November the 18th. That's like your W-9, your statement of, what is it, your agreement.
Yes, service agreement.
These are things that Marshall University Fiscal Department requires in order to process a check. That normally takes about 6 weeks. We'll have a kickoff meeting on November 29th, and then boom, you're off to the races. You can go with it. Just keep us updated. Our quarterly meetings, which we only have 2, and let us know how we can better support you as you implement your program activities. And that's it. That's it. I think that wasn't bad. Hopefully that wasn't bad. Any questions or comments? Questions, comments, thought processes, complaints about the funding amount?
Hey, Regina,
Yes.
this is Jerry Bice with the Boone County Health Department. I noticed that you'd said that last year you thought you'd given some money to Boone Memorial Hospital. Didn't know if you could give us any, but is that for the county then, or would that be separate for us?
That's
As far as
separate.
Separate,
Yeah.
okay, so we still could apply then.
Yes.
Okay, it is something we've talked about, and one of our head nurses here, she has done some teaching on, especially on diabetes, on people, what they should fix, how they should fix it to help with their diet and those kind of things. And we've got a kitchen and everything set up here that we could do those trainings, and we've been kicking it around wanting to do that. So hopefully something like this would give us what we need to get that started maybe.
Absolutely. And thank you for joining, Jerry. We appreciate you.
Well, like I say, we're trying our best to do everything we can for our people, and everybody that on this call, that's what they do.
Yeah.
We serve the people in our communities. We love these people and they need help. So
We appreciate that, Jerry. And Jerry, I'm in Boone County. I live in Boone County.
okay, I've been here all my life.
Me
Not-
too.
Not because I have to be, because I want to be. There's some good people here. But I always tell people, I said, we work for you, and we're trying our best to do everything we can to help.
Absolutely. And it takes a community. One person can't do it alone. It takes a community, the whole community, to pitch in and help people reach the goals that they want to reach. It's about quality of life. And we want to see our friends, our family, our loved ones, our teachers, our preachers live as long as possible.
That's right. I appreciate Marshall helping out the way they are. That's great.
Our pleasure. It's been our pleasure.
Hi, this is Crystal Moberly, and I'm with Putnam County Health Department. And I just learned of this a few hours ago when I received an email from Deb Keister. And so I just hopped on the call. I quickly reviewed some of the materials, so I'm not well versed at all at any point just yet. But my question is, I would love to participate in this and bring this to Putnam County and help with any of our rural residents that may not have good access to care. But are there any prerequisites, or do we need to be already certified or affiliated with any? Like I think I read on the diabetes program, perhaps yes, maybe not with the blood pressure self-management program, but anything else that I have nurses and that's it.
Well, nurses are, the foundation of our healthcare system, really. And what we're really looking for are existing programs. So with the diabetes self-management education, if you currently have a program that you want to expand, in particular, increase the number of people that are taking advantage of the program, this is a way to do that. So expanding referrals, increasing referrals, partnering and working with other people to let people know, hey, we have a diabetes self-management education program, or we have a blood pressure program where people can learn how to monitor their blood pressures at home, and we want you to participate in that. So it's in increasing what you already have.
Okay, so I can apply for these grants, both of them, without any type of like certified diabetic trainer on staff?
Correct, but the only caveat is that the diabetes self-management education program has to be accredited already. So it needs to be accredited by the American Diabetes Association or the American Diabetes Education Specialist. I changed the name. So yeah, with the DSMES, it has to be an existing program accredited by one of those two organizations. But you know, SMBP doesn't have an accrediting body, so it could be a custom program. We do ask that it provide blood pressure monitors to their participants and some way to track that over time, just so you can get a baseline and then an end measurement to see if there's a change in their measurement based on the education that you're providing them. But other than that, there's not a particular curriculum.
Okay, so we're not already part of any type of program.
Okay, so you're looking at creating a new blood pressure program, is that correct?
Yes, we are not affiliated with any program, do not have any specific program. We just provide basic services here at my health department. You know, we do immunizations and we do blood pressure checks, but we do STI testing, but we do not have provider visits, so we don't have anybody certified in any type of blood pressure management program or diabetes already. So that's where I'm not clear. I mean,
Well,
if we just
maybe we can talk about how you can word it so the blood pressure checks that you are doing can be an extension of a blood pressure program, because it would have to be blood pressure checks, and that would apply to all the county health departments. So if you don't, I know this is being recorded, so we're just trying to figure out a way to get the money out, but so blood pressure checks, if you identify people who have measurements above, have elevated measurements, it could be worded to where this self-measured blood pressure program is an extension of that, and you want to expand that program. Are you following where I'm going?
I think so.
Okay.
I know that diabetes is different. Like I said, very, very quick overview. So I'm ignorant at this point to, how everything read on the grant documents. But I think I did see something where you would not apply for this grant if you are not already a certified diabetic trainer, I believe is what it said.
That's for the DSMES, and you are correct. You have to be an existing DSMES program, and those programs are accredited by the American Diabetes Association or the American Diabetes Education and Care Specialist. So for that one, you wouldn't be eligible. But for the SMBP program, it would have to be worded that the program would be an extension of the blood pressure checks that you're already doing. So it's not, so it's not a new program because you're already doing blood pressure checks, but there's a difference between blood pressure checks and blood pressure self-monitoring.
Sure, okay. Thank you, I do understand. So I jotted that down and I appreciate that.
You're welcome. Sheila, do you have any thoughts on that?
Well, let me give you this scenario, Regina, just so that that I'm clear too. Let's say that the health department is doing a healthy eating program, and they've been checking those people that come in for this class, their blood pressures. They've been checking it, but they've not really done anything with that. But they want to expand that blood pressure program with that cohort of people. They can therefore apply for this grant to increase their referrals.
Yes, that's it. That's it. You got it. It has to have those keywords in there. Existing, extension, referrals. Boom, boom, boom.
Yeah. And really, honestly, when you guys are writing your proposal out, okay, and you have those questions, or you want to send us that feedback and you say, hey, does this sound like what you're looking for? Can you give me some feedback? We'll do that. If that makes sense. So we're just not going to do the information center session and then just twiddle our thumbs and wait on the application to come in. We'll be glad to help you.
All right, that would be great. This is
Okay.
good. That would be great. And I figured you would, and we certainly appreciate any help we can get. You know,
Okay,
it's just one of those things. Money's hard to come by.
Yeah.
Hi, you guys in Boone County and my fellow health department administrators.
Yeah, we're sadly all in the same boat you are, so don't feel like you're the only one that doesn't know. Somebody asked me the other day how I was doing here at this new position. I said, well, I don't even know what to ask yet, so I guess I'm doing okay. Ignorance can be bliss.
So this slide that you have up with the contact, is that, I'm going to take a picture of it with my phone, but is that part of, do we get an email on that as to these links? And
Yes, you can, so it's Deb, who is our supervisor, and then Sheila, who's on the call with me, and then Regina, that's me. And we will also post this information session on our YouTube page. But and you can email us. We'll schedule a time to just hop on Zoom or a conference call to talk about what your thoughts and plans are. You can, send us a little blurb of what you're thinking, and we'll be happy to review it. So we're very informal. We're like family oriented. We're gonna work together.
wonderful, thank you.
You're welcome. Because we can't keep this money. It's not our money. We want to give it away. Because if we don't give it to you, we got to give it back, and we don't want to give it back.
Well, this is perfect timing because I'm working right now to expand our strategic action plans, like our goals, and how we want to expand out into the community and the rural areas, and just find more means to provide expanded access to care. So if this is just yet another tool that will help our residents, this is just wonderful. So
Great.
And then on our quarterly calls, you'll meet other organizations who have been awarded previously, and you can hear from them how it's going, how they've been able to sustain. So we just learn from each other. We share information, we share ideas. If somebody has a great tracking mechanism they got for their participants, they share it with everybody else. I got this from Amazon. It was for $5. You can get this book. We share. We believe in sharing resources and materials.
Sharing is caring is what we always say.
Especially on a budget. Especially on a budget.
very good.
Any
Well,
other questions?
This is Valerie. I just had a quick question about the DSMES grant. When you said it had to be a healthcare provider, can that be, I'm a registered nurse, certified CDCES. Is that qualify as a provider, or does it have to have a higher level provider?
oh, you're it. You qualify.
Okay. I may need some help on the planning of this, but I may reach out to you. But I just wanted to clarify that question as to whether I needed to have another provider over top of me.
No, we're boots on the ground.
So this is Ellen again. One last question for me. Suppose I'm going back to the internal referrals. Would it be possible to use something like emergency room visits for acute high blood pressure issues, to be able to track that some way in our EHR and have those people referred to us for SMBPs. Is that something that falls into that category?
That's an excellent avenue.
Okay.
I love
Okay.
it.
So if we currently don't have something in place for that, that might be where that particular grant could be used.
Absolutely.
Okay. Okay. Just trying to clarify it in my own brain. Thank you.
All right, well, if no one else has any other questions, we're gonna give you back the last 13 minutes of the hour.
Yes.
We don't believe in prolonging the meeting.
Yeah.
Yeah, enough meetings for that. But once again, this recording will be posted on our YouTube page. If you want to share that out with anyone, please write down our contact information. My information is listed on the FOA. And yeah, if you have any other questions, you can reach out to us and we'll schedule some time to meet with you and your team if you like.
Yeah.
All right, y'all have a good Friday Eve. This Thursday, right? Friday Eve. Have a good weekend.
You too. Thank you.
Good luck on your application. Thank you.
Thank you.
Thank you.